Did you know that your body often sends warning signals a month or even just days before a stroke occurs? Strokes remain one of the leading causes of death worldwide, and the numbers continue to rise. The strangest part about strokes is that while their symptoms often appear suddenly, the actual damage can progress over hours or even days. This makes recognizing the early signs absolutely critical. A stroke is a medical emergency. When the blood flow to a part of the brain is interrupted, whether due to a blockage or a rupture, that section of the brain is deprived of oxygen and essential nutrients. Without immediate attention, brain cells begin to die at an alarming rate. Thousands of neurons perish every second. The result? Long-term disabilities or even death. Cardiovascular diseases, including strokes, are increasing globally, alarmingly so among younger populations. This trend underscores the importance of understanding and acting upon early warning signs. Many of these signals are subtle and often dismissed or mistaken for less serious issues. However, ignoring them could cost you your life. In today's video, we'll delve into 7 key warning signs that may appear up to a month before a stroke, and we'll explore practical strategies to prevent this life-threatening condition. The first and one of the most critical warning signs of an impending stroke is persistently high blood pressure, or hypertension. Blood pressure is the force exerted by the blood against artery walls as the heart pumps it through the body. While necessary for circulation, consistently high blood pressure can significantly increase the risk of stroke if left unmanaged. High blood pressure strains blood vessels, causing them to weaken and narrow over time. This damage makes arteries more prone to rupture, which can result in a hemorrhagic stroke, a condition where a blood vessel in the brain bursts, leading to bleeding, increased pressure, and tissue damage. In ischemic strokes, high blood pressure contributes to the narrowing of arteries, reducing blood flow and potentially causing blockages. These blockages deprive the brain of oxygen and nutrients, leading to cell death. Because high blood pressure plays a key role in both types of strokes, it is vital to monitor and manage it effectively. Lifestyle changes like reducing salt intake, eating a heart-healthy diet, staying physically active, and adhering to prescribed medications can help maintain healthy blood pressure levels. Regular monitoring and working closely with a healthcare provider are essential for those diagnosed with hypertension. In summary, high blood pressure is a silent but powerful risk factor for stroke. By keeping it under control through lifestyle adjustments and medical care, you can significantly lower your risk of stroke and protect your overall health. The second warning sign of a potential stroke is excessive fatigue, characterized by extreme or persistent exhaustion that isn't directly related to physical activity, lack of sleep, or stress. This type of fatigue often feels unusual or disproportionate to any recent activity and doesn't improve even with rest. Fatigue linked to a stroke can result from reduced blood flow to the brain, caused by narrowed arteries or a potential clot. When the brain doesn't receive adequate oxygen and nutrients, its ability to function decreases, leading to profound tiredness. In some instances, this fatigue may signal a transient ischemic attack, TIA, also called a mini-stroke. TIAs involve a temporary blockage of blood flow to the brain, and while they don't cause permanent damage, they are critical warning signs of an increased risk of a full stroke. Fatigue from a TIA can occur suddenly and may accompany symptoms like dizziness, confusion, or numbness. While fatigue is a common symptom of various conditions, unusual or persistent tiredness should not be ignored, especially if accompanied by additional signs such as weakness, difficulty speaking, or vision changes. Seeking medical attention is vital to determine the underlying cause and prevent potential complications. The third warning sign of a potential stroke is sudden vision problems such as blurred vision, double vision, difficulty focusing, or even partial vision loss. These symptoms occur when blood flow to the brain is disrupted, particularly in the areas responsible for processing visual information. The brain plays a crucial role in interpreting signals from the eyes, and any interruption in its blood supply can directly affect vision. Stroke-related vision problems often result from blockages or narrowing of arteries that supply blood to the optic nerve, or the occipital lobe, which is the brain region responsible for visual processing. For instance, If the optic nerve, which transmits visual information from the eyes to the brain, doesn't receive enough oxygen and nutrients, it can lead to blurred vision or even temporary blindness. Similarly, when the occipital lobe is affected, visual disturbances like double vision or difficulty focusing may occur suddenly and without warning, alarming the individual experiencing them. It's worth noting that while vision issues can be caused by other conditions like migraines or eye disorders, sudden unexplained changes in vision should never be ignored, especially if they are accompanied by other symptoms such as weakness, numbness, or trouble speaking. These combinations strongly indicate the possibility of a stroke and demand immediate medical attention. Sudden vision problems are a serious and clear signal of potential stroke risk. Recognizing these symptoms and seeking urgent medical care can make a significant difference in preventing severe complications and ensuring better outcomes. The fourth warning sign of a potential stroke is sudden numbness or weakness in the extremities, particularly when it affects one side of the body. This can manifest as a tingling sensation, loss of feeling, or significant weakness in the arm, leg, or face. The sensation often makes it difficult to move the affected limb or perform everyday tasks. Importantly, this symptom tends to appear suddenly and without prior warning, making it a critical indicator of a potential stroke. This numbness or weakness happens when blood flow to a specific area of the brain is interrupted, depriving it of oxygen and essential nutrients. The affected brain region, such as the motor cortex responsible for controlling movement, may temporarily or permanently lose function, depending on the severity of the blood flow disruption. In most cases, the symptom impacts only one side of the body, due to the way strokes often affect a single hemisphere of the brain. For instance, if the right side of the brain is affected, numbness or weakness may occur on the left side of the body, and vice versa. While the sensation may last for a short time, even brief episodes should be taken seriously as they might signal a transient ischemic attack, TIA, or an impending stroke. Although other conditions like a pinched nerve or neurological disorders can cause similar symptoms, sudden numbness or weakness, especially if accompanied by difficulty speaking, vision changes, or confusion, should prompt immediate medical attention. Early recognition and action are key to minimizing stroke damage and improving recovery outcomes. The fifth warning sign of a potential stroke is sudden speech problems, which may include slurred speech, difficulty finding the right words, or trouble forming coherent sentences. This condition, known as aphasia, occurs when the brain regions responsible for language processing, such as Broca's or Wernicke's areas in the left hemisphere, are affected by reduced blood flow during a stroke. Individuals experiencing aphasia may struggle to communicate clearly, with speech that sounds garbled or disconnected. In some cases, they may also have difficulty understanding spoken language or following conversations. For example, they might answer questions inappropriately or fail to recall common words, making their speech appear jumbled. Speech problems due to a stroke can vary in severity, from mild difficulty speaking to a complete inability to communicate. Even if these issues seem temporary, they should not be ignored, as they strongly indicate a potential stroke. While other conditions like dental issues or alcohol intoxication can affect speech, sudden speech difficulties accompanied by symptoms such as numbness, weakness, or vision changes warrant immediate medical attention. Early treatment is critical in minimizing brain damage and improving recovery outcomes. The sixth warning sign of a potential stroke is a sudden and intense headache, often described as the worst headache of your life. These headaches are different from typical tension headaches or migraines due to their sudden onset and extreme severity. The pain can be so intense that it feels unlike anything the person has ever experienced before, which is why it's crucial to pay attention to this symptom. There are two main types of strokes that can cause such intense headaches. One, ischemic stroke. This type occurs when a blockage in one of the brain's arteries disrupts blood flow, leading to a lack of oxygen and nutrients to the brain tissue. Although not all ischemic strokes cause headaches, those that do are often marked by sudden and severe pain due to the increased pressure on the brain from restricted blood flow. 2. Hemorrhagic stroke. This happens when a blood vessel in the brain bursts, causing bleeding in the brain and rising pressure within the skull. Hemorrhagic stroke headaches are typically described as explosive and may come with other symptoms like nausea, vomiting, or heightened sensitivity to light, which are signs of increased brain pressure. In both cases, the headache is often accompanied by other stroke-related symptoms, such as weakness or numbness on one side of the body, vision problems, or difficulty speaking. This combination of symptoms should never be ignored, as it signals a medical emergency. A sudden, excruciating headache could also point to the rupture of an aneurysm in the brain, which can lead to a stroke. While headaches are usually caused by less serious factors like stress or dehydration, a sudden, intense headache with no apparent cause, particularly when accompanied by other neurological symptoms, requires immediate medical attention. Recognizing this warning sign early can make a significant difference in the outcome, minimizing brain damage and improving recovery prospects. The seventh warning sign of a potential stroke is the presence of other neurological symptoms, such as memory problems, loss of balance, nausea, and vomiting. These symptoms may appear days or weeks before a stroke, and while they might initially seem unrelated, they can be early signs of a brain issue. Memory problems. Sudden memory lapses or difficulty concentrating can indicate disrupted blood flow to brain regions responsible for cognitive functions. These problems may worsen if a stroke is imminent or already affecting brain function. Loss of balance. Difficulty maintaining balance or coordination is a key warning sign. A stroke can disrupt the brain's ability to control muscles and movement, causing dizziness or a sensation of imbalance. This symptom may make it hard to walk or stand without support. Nausea and vomiting. Although often linked to other conditions, nausea and vomiting can also occur during a stroke. These symptoms are typically caused by increased pressure in the brain from disrupted blood flow. Other neurological signs like sudden confusion, trouble walking, or vision problems can also be indicators of a stroke. Even if these symptoms improve on their own, they could be signs of a transient ischemic attack, TIA, which is often a precursor to a full stroke. In conclusion, neurological symptoms like memory problems, loss of balance, nausea, and vomiting should never be ignored, especially if they appear suddenly or without an obvious cause. These could be early signs of a stroke, and immediate medical attention is essential. Recognizing these symptoms early can make a significant difference in preventing long-term brain damage or even death, so it's crucial to seek help at the first sign of these issues. Preventing a stroke requires a combination of lifestyle changes and proactive health management. The key factors in stroke prevention focus on maintaining good cardiovascular health and managing risk factors that contribute to stroke, such as high blood pressure, diabetes, and high cholesterol. 1. Control blood pressure. High blood pressure is one of the leading causes of strokes. Regularly monitor your blood pressure and take prescribed medications if needed to keep it within a healthy range. Making lifestyle changes such as reducing salt intake, managing stress, and exercising regularly can also help control blood pressure. 2. Maintain a healthy diet. Eating a balanced diet rich in fruits, vegetables, whole grains, and lean proteins can lower your risk of stroke. Limit the intake of processed foods, sugary snacks, and excessive salt, as they can contribute to high blood pressure and poor cholesterol levels. Incorporating foods high in omega-3 fatty acids, such as fish, can also support heart health. 3. Exercise regularly. Physical activity helps improve cardiovascular health, maintain a healthy weight, and reduce the risk of high blood pressure and diabetes. Aim for at least 150 minutes of moderate intensity exercise each week, such as walking, swimming, or cycling. 4. Quit smoking. Smoking is a major risk factor for stroke. It damages blood vessels and increases the chances of blood clots, which can lead to a stroke. Quitting smoking improves circulation and reduces your overall stroke risk. 5. Limit alcohol consumption. Excessive alcohol intake can raise blood pressure and increase the risk of stroke. It's recommended to drink alcohol in moderation, if at all, limiting consumption to 1 drink per day for women and 2 drinks per day for men. 6. Manage diabetes. High blood sugar levels can damage blood vessels and increase the risk of stroke. If you have diabetes, work with your doctor to manage your blood sugar levels through medication, diet, and exercise. 7. Reduce stress. Chronic stress can contribute to high blood pressure and poor heart health. Finding ways to manage stress, such as practicing relaxation techniques, meditation, or yoga, can significantly reduce your stroke risk. Incorporating these lifestyle changes into your daily routine, along with regular checkups with your healthcare provider, can significantly lower your risk of stroke. By addressing these risk factors early, you can protect your heart, brain, and overall health for the long term. If you found this helpful, don't forget to like this video, subscribe to our channel, and share it with others who might benefit from this information. Together, we can raise awareness and promote a healthier lifestyle. Stay safe and take care of your health.